Hi, this is Dr. Robert Antolak from the Gentle Dentists. We're in Shelby Township, Michigan. 586-247-3500 is our number, and you're going to want to have that number because you're going to want to give us a call when I'm done recording this video. So I just want to let you know that one thing that we are working on a lot with our patients who have dentures. Dentures are one of those things that nobody really wants to have, and there's kind of like a naysay about it. But the reality is that there's a lot of people who have bad teeth, infected teeth, and there's not a whole lot of different options for them. Of course, if we have the ability to pre-plan it and everything else, and they have the funds or can have the credit, because we do have a lot of credit available at our office, then they can have something called a hybrid denture. But I do want to go over the first things about dentures themselves. When a patient or a person really has the issue with having to get a denture, there's a lot of emotional ties obviously attached to our teeth. We want to have what God's given to us, and sometimes people feel like when they have a denture that they've been a failure. That's understandable. Many times through either poor nutrition or bad diet or gum disease. There's really not a lot of options, but somebody tends to feel and regret the fact that they've let their teeth and their smile go to the point where it feels like it's no return. We can help rebuild that confidence back up, but there's definitely a lot that goes into it. Once again, people feel like they want to keep what they have, and the reality is it is definitely better to have your own natural teeth. But when they're infected, that just creates all kinds of issues with your health and everything else. So sometimes people have to go to have dentures, and when they do, there's a lot of different things that go into it. Not only the emotional part about it, but the ability to chew your food. When a full denture like this is used, number one is it covers the entire roof of the mouth, as you can see here, and therefore heat is transferred and taste is actually felt from the roof of the mouth in the palate. And so when that's covered up, we kind of lose that ability to feel the taste and temperature of food, which gives it the delightness of doing that. Another issue that people have with a full denture after the teeth are removed is the fact that this depends on suction to keep it up. So the roof of the mouth is here. When it's made, impressions are taken, which are like molds of your teeth, and it's made so that it fits intimately against the roof of the mouth. Well, over time, you can get resorption, or the bone shrinks down, and when that happens is that you can lose that ability for that to hold up in place. Therefore needing some denture adhesives, and that's okay. Using a little powder adhesive on the top and keep it in place is fine for that purpose. Also, another issue people have is when they're going out. There's always the fear of this thing loosening up when they're with their grandkids or when they're eating a meal and they're laughing or drinking something. All of a sudden, this thing pops down. It's totally embarrassing, and they're totally understandable about that. And also when eating foods, you have to be really careful, because on dentures, you don't really have that feeling like you do in your own natural teeth. And if food gets trapped up there around the dentures, then what it can do is it can create embarrassment of something that's sitting there, and you're talking not even knowing it. So recommended maybe to keep some water there so you can kind of rinse your mouth out a little bit, at least rinse out, and then you can dismiss yourself if you feel like there's something there, going to the restroom if you're at a restaurant or something like that. So dentures are an issue with that, of course, but at least it's something that replaces infected teeth. The next step that we usually recommend is if someone comes into us with a mouth that's compromised, where the teeth are infected or a lot of cavities, and sometimes there's a point of no return. So you want a permanent solution. That's when we do our full hybrid denture that's actually attached to implants. And I'll get into that into the next video. But right now, I just wanted to talk to you a little bit about, some of the issues that people have with dentures, the emotional aspect of losing your teeth. So give us a call at 586-247-3500 if you have a denture that's not fitting you well, or if you want to talk about either having another one made or even upping it to getting something that's supported by implants. Thank you.